Welcome back to Evening Plus. Local nonprofit First Steps Kent is launching a new early relational health initiative. It's all centered on really positive, meaningful connections between children and their caregivers. We've got a full house here for Evening Plus tonight. I'm joined by Jennifer Headley-Nordman. Jennifer, you're the president of First Steps Kent. We've got Dr. Kira Siplinga, and you work through both Helen DeVos and Corwell. Is that correct? And then Anthony Queen, you are sort of the parent advocate for all of the work that this organization is doing. Guys, thanks so much for being here to talk about this. For anyone in the community who has not heard of Next Steps Kent, maybe we start with you, Jennifer, just about what is Next Steps Kent, what is it all about?
Yeah, First Steps Kent is a nonprofit organization that's focused on healthy development and school readiness for children birth through 5, and we also provide resources and support to parents.
Yeah, and you guys have been around about 10 years at this point?
Yes, correct. Many in the community are familiar with us as the funding administrator for the Ready by 5 early childhood millage, but we do a lot of other work as well, just making sure that we have a coordinated system that works for children and families.
Okay, and so this new initiative, I know it's really centered around these meaningful connections between caregivers and obviously young children. That's what you guys specialize in. What does this look like? Why are you guys starting this, and what's it going to provide?
So early relational health focuses on the foundation of where children really get their relational understanding of working either with adults in the future like teachers or other caregivers, but it focuses on those early experiences that an infant, toddler, or preschooler has with their parent or other caregivers, because we know if there's a foundation that feels safe, predictable, and nurturing, we have better health outcomes for our children.
Yeah, which is so important. And I know you both play such an important role in developing this and fostering this in our community. Can you kind of tell me, both of you guys, sort of your role in all of this and why it's so important?
Well, my role, I'm a general pediatrician. I work for Helen DeVos and Corwell. And as a general pediatrician, this is what we do.
Yeah.
So we want to help our patients and their families thrive and be healthy. And part of that is this early relational health experience. And it's very important that we partner with our community in allowing our patients and their families to have connections and to be fully nurtured by the community and the community resources that we have. Yeah. So for me, having partnerships with the community is what makes our children and their families thrive.
And ultimately, we're talking about really little kiddos at this point, 0 to 5, those really foundational years. From a kind of medical perspective, your field of work, how impactful is what those first 5 years looks like in relation to, once you're growing up, child, teenager, and adult?
Yes. Well, the evidence is very clear that the early first years of your development really help impact either your mental health and your physical health, your emotional health for middle to late childhood and into adulthood, especially mental health. But also we're seeing some connections with things like asthma, your physical health, your weight, cardiovascular health. A lot of it can be tracked back this early. So you'll even see, like in the newborn nursery or in the NICU, they've learned about this really a while back, and that's why we have skin-to-skin initiatives right there in the nursery, in the NICU with our premature babies who are so high risk for their physical health. We understand the importance of that nurturing connection, not only with parents, but with the community around them.
Absolutely. And Anthony, you play this pivotal role in all of this, in really bringing, what these ladies are talking about close into the community. Tell me a little bit about how you're involved in all of this.
Well, all these programs, you first have to build trust within the neighborhood, and especially minority neighborhoods. And a lot of them have been so marginalized and not have their voices heard that it doesn't matter what we offer if we're not where they are. And it's really about meeting parents where they are.
Yeah.
And one of the things that's so important about the ERH effort is the minority mortality rate at childbirth is abysmal, it's been abysmal, and we need to do something about that. And it's not just going to change itself. So that's one of the things that's very important to me in this initiative, is to try to take a look at that and see what needs to be. We already know what needs to be done. We don't need any more surveys. So let's try to bring some answers to the table and try to change that. Because it's just been the same number for way too long.
Yeah. Absolutely. And so now you guys have kind of provided this foundation of where you want to go and how you want to be able to improve upon this and connect with the community. What will this actually look like as far as making progress towards some of these goals? I'll let any of you guys kind of take that question.
Yeah, we have been lucky enough to have a partnership with Georgetown University and Nurture Connection to really look at one, recognizing all the rich resources that we have in Kent County. We have amazing medical organizations and entities that are here supporting the work already, but we also have amazing parent networks. And so how do we bring those two groups together and have authentic conversations about where we still have needs and gaps? It's really about how can we take the existing resources, connect those in a more thoughtful way, so that when parents and others are looking for resources related to early relational health, they can navigate and find those answers and solutions quickly.
Taking what we already have and obviously the beautiful community that we have here, but making sure that they're meeting in the middle to be able to get the help that they need. I know that's, Anthony, what you were talking about. So as far as, actual, activities and processes, what is that looking like to sort of make that happen?
We've already had one convening where we reached out to stakeholders who are already engaged in this work. So either they have early relational health practices within their hospital setting or within their organizational training and curriculum, as well as those parents that are interested in this work, and brought them together and started to have some conversations. Again, like, where do we see strengths within our system? How do we connect and how do we elevate? So it's really about coming up with a plan that makes sense for us as a community.
Yeah, so right now it's sort of figuring out how best to, bring these two entities together. Would you guys agree with that?
We really want it to be led by the community.
Yeah.
We don't want to come in with a prescribed plan because, as Anthony had shared, we want to make sure that those that are interested in being engaged in this work have an opportunity to lend their voice to the solution space.
Yeah, Anthony, I know that's really what your big main point was that, we do have so many great resources in our community that have been around for a great while, but if we're not connecting them to people, especially our marginalized groups here in Kent County, they're not getting anywhere.
Well, a great philosopher in this work once said that collaboration moves at the speed of trust. So if you don't trust the people who are coming into your community, and a lot of these multi-generational homes have a reason to feel that way, then we need to earn that trust. It's nothing that they can do to go back and change what's happened, but we can look forward and make sure that people feel comfortable and feel, good enough to put their trust in our hands, so to speak. And so it's kind of like I call it like a parent bill of rights to help them in a system to where they want to go. And we got to make those adjustments because we know, it's not even and it's not fair, but we're trying to work at that. And I commend First Steps because they're one of the first ones in Kent County to have a look at that and know really to put some trust in parents' hands. A partnership is not telling parents what to do, then going out and selling it in the neighborhood. It's about coming to the table and building that table together and moving from there.
Yeah, absolutely. And as far as, moving forward, I know you guys are launching this. Obviously, it's still in a very collaborative point at this time to really see, what parents are interested in and where they need help, and then connecting with the community. For folks who are watching and hearing about this and say, I want to be a part of that, or I have thoughts to share, or I'm a provider of some kind that wants to be better connected, what should they do if they're hearing about this and they want to be involved in one way or another?
Absolutely. They can always reach out to First Steps Kent. We're still in that process where we have room for more voices and more input. And so, again, we want those organizations that are already doing this work. And we are trying to find all of those places where that's occurring, but there may be those that are out actively engaged in early relational health and they're not part of this work yet. So we want them to be included.
Definitely. Is there anything from any of you guys that I haven't asked that you really want to get out there that you want people to hear about this, any aspect of it at all? I always like to ask that to sort of finish things off.
Well, I really love that we are here all together. So I think from a pediatrician standpoint, we have the honor of seeing these babies from 0 out to 5 multiple times, but sometimes maybe we don't do the best job of earning trust and really meeting families where they're at, and that's where this is built upon. I really love the focus of positive childhood experiences. This work is focused on that. And how can we as pediatricians, as providers, as healthcare providers, build on the trust and help promote those positive childhood experiences in the community?
Yeah. Awesome. Well, I so appreciate you guys all being here. I know, again, this is really just getting started to be able to foster these connections in such meaningful ways with the community, with all of the different kinds of providers that are so important for, kiddos that are this young. Again, if you are interested in this in any way, reaching out to First Steps Kent, and ultimately, we'll just have to wait and see sort of where this goes. I'd love to get a kind of progress update from you guys down the line. And I appreciate you all being here and talking about this. Really great conversation.
Thank you
And
so
can I
much.
just add real quick?
Yes.
We know that you can't build trust with a mission statement or organization or a program. You have to build trust. It's like a people-to-people contact.
Yeah.
So that's one of the main things that we're going to be concentrating on as far as First Steps Kent and this effort, along with the hospital.
With the hospital, yeah.
And we want to get the medical profession involved because
Yeah.
a lot of times the medical profession sit on the side. They don't sit on the sidelines, but they're not involved in the day-to-day and the way we want to operate and meet people. So I think that's important, and I'm glad that they're here as well.
Yeah, absolutely. I appreciate you guys all being here talking about this in a very honest and open way. And I can't wait to sort of see where this goes and what it can do for our community.
Great.
All right.